And we are live. It's the Dave K Show. How's everybody doing out there? I'm David K. Gyro, and I have my beautiful co-host, Miss Casey Fry.
Hello. How are y'all doing today? Thank you for being with us.
Yes, glad to have you here once again, Casey. Midweek, bad weather outside, rain or shine.
It's terrible. Yes.
You're always looking good no matter what. I got bad hair days on the weather. Some of our guests have
got a little wet, but you just got to make it work. It's fine.
Right. Yeah, sounds great. So we have a great show lined up today. A guest that you got us on the show for today. So
yes, he's actually a very good friend of mine. I've known him for over 20 years.
Wow,
now.
long time friend.
So a very long time, and he's going to talk about a medical condition that's that he has that's been very, had a lot of impacts on his life and a lot of different areas, things like that. But I do want to, before we get into that, go ahead and congratulate the new sheriff of Point Coupee Parish, Mr. Renee Thibodeau.
Give me five.
Congratulations. We are very happy for you. I'm sure you're doing great things for the community, and we wish you the best of luck.
Yes, you do. Congratulations.
Absolutely. And a quick shout out to the PointCoupeeReporter.com and the Point Coupee Banner. There are our local what would you call them? Media sources. Thank you. Over here online, both and online and publications. So please feel free to check those out, and you can see some local stories and some great things to check out in Point Coupee, New Iberia, that kind of thing.
Absolutely, sounds great. Yes. So first of all, our takeoff row. Before we get started with our great guest today, how have you been doing lately?
Been doing good.
Okay?
Adjusting to life after Mexico, which is not fun. But
right. Right. Yeah.
Reality is back to reality, but I'm I have 2 surgeries coming up, so I'm trying to mentally prepare and get everything ready and just balancing a lot of things. So it's okay. It could be more fun, but
Sure,
there's a lot of stuff to get me distracted, baby showers and parties and Halloween.
Right.
Oh my.
Oh, no, Halloween's coming up pretty soon.
Yeah.
Yes,
So it'll be fun.
A lot of fun. So sometimes you got to trudge through the bad stuff to get to the good stuff.
Exactly.
And life is a series of ups and downs, of course.
Yes, it is.
So
yes, it is.
hopefully have more ups than downs.
Yes, and hopefully it won't be hurting again. Basically, long story short, I have to get my wrist cut in half and then shortened right about there, and it's going to take a very long time to heal, and it's not going to be fun.
Right. So let's talk a little bit about that, because people out there might be watching that may have similar conditions and you have whatever. So what's wrong with your hand?
Well, basically it's a mixture of things. I'm considered hypermobile, and there's you can go online and find out if you can stretch your thumb a certain way, if you can sit a certain way.
Is that different than being double jointed? Because I'm double jointed.
You can be considered double. That's what technically no one is double jointed. It's the ligaments letting go, and
interesting.
It's actually having really loose ligaments. So
seems to me that double jointedness kind of runs in families, because like 2 of my kids have they're double jointed too.
From the research I've done online, it is. My grandmother is also hypermobile, and she's more flexible now than most people are in their 40s.
That's amazing.
And most nurses that come and take care of her are just amazed, and so things
Let me ask you this real quick, because so double jointed means because you have a lot of different joints and everything. Because so like my thumbs go back way far back than a lot of other people's, and my wrists go back pretty much.
It's a myth essentially. If you're double jointed, all that means is that I can show you. Like for instance, this is normal, and then I can pop this one out completely to make it longer, and it's harder. But it looks like it's double jointed, but it just essentially pops out.
That is cool. Now how about people's elbows?
It's all the same.
That's a good party trick.
Ligaments, and there's a couple of different. It's all part of ergodanos syndrome, and that's what the contortionists have. You can flip everything.
Right.
And so the next stage after you're hypermobile is if you can stretch your skin, and it goes right back.
That's amazing. So really, it has nothing to do with the muscles per se, because we always talk about stretching our muscles and being real limber, but
it's all ligaments and tendons, which can actually cause a lot of problems, because I've already had my kneecaps have already started popping out of place, which is why I had to get my knees reconstructed. I always had tennis elbow from throwing sidearm growing up. So I always had a lot of joint issues. So this is not one I was anticipating, but basically the 2 bones that are right here are supposed to be fused together, and they're just kind of not.
Wow.
The ligaments are kind of floating around in there. There's a part of a broken bone floating around as well. And it's just this bone is actually longer than this one, which is not how it should be for reasons I have no idea.
Wow.
So we're going to correct that problem so it doesn't cram into the rest of my wrist. And
is that going to be like a one-time surgery, or is it going to have to be?
Hopefully.
Right. Yes. Keep our fingers crossed.
Yes.
See how good your doctor is.
I'll have 7 screws and a plate to keep it, to keep that straight, and then I have to make sure They want me to move it, but with no cast. So,
Wow.
but I can't lift, push, pull, or anything with pressure for 6 weeks. But they want me to move it, so I'm going to try to learn sign language in that time.
That's a very good idea. I love it. Do
try
something
to kill
constructive.
2 birds with 1 stone.
Now, next time you go to Mexico, are you gonna have problems going through the metal detector? Or how does that
I
gonna
shouldn't.
work?
Titanium
Okay.
doesn't show up.
Oh, really?
Yeah.
Okay.
No,
I don't know,
it's too light of a metal.
Interesting.
So usually, if you do have a medical device that will pop up, they'll give you a card. I remember my dad had a card for his pain pump.
Right.
Just to prove that you do have a medical metal device in you, that you're not trying to get anything past TSA. But normal medical devices like normal screws and stuff are just made of titanium.
Interesting. Yeah.
Which are not magnetic.
And of course,
really.
titanium is a strong metal, and it's very lightweight too.
Oh yeah. It's great.
Very interesting. Wow, that's amazing.
Not fun to have in your body.
Yeah, so that's a good segue. I wanted to talk about this because it's going to segue into our guest that we have today. So, he's a special friend of yours, like you said, 20-year friend.
We actually went to junior high and high school together.
yes.
Well, awesome.
Yes, we did. This is Michael McMorris.
Yes, so go ahead and introduce Michael and tell us what he's all about here.
He does some IT work for a gas and oil company in the area, and he also suffers from trigeminal neuralgia. Am I saying that correctly?
Yes.
Okay.
And there are 2 types.
Okay, please, yes, just tell us about it.
Type 2. Type 1 is characterized by extremely sharp pain in the face, like 10 out of 10.
Jeez.
Totally non-functional.
Now, I grew up with migraine headaches, and it was like somebody sticking a screwdriver in your eye or whatever. Is it similar to that?
To put it in perspective, so there's a McGill pain scale. It goes from 0 to 50. Chronic migraines rank a 29.
Wow.
Trigeminal neuralgia ranks a 44.
Jeez.
So that's kind of what you're looking at.
What is childbirth on there, just so I have an idea?
Interesting, yeah.
Unprepared childbirth is a 36.
Wow.
Jeez,
Okay.
man, what is,
you would think that can't be right. I have actually talked to
no
people
epidural.
with this condition
Right.
and have had children without an epidural, and they would take that over trigeminal neuralgia.
Kidney stones.
Kidney stones rank a 42. So we're very close.
Okay.
Wow, how about stepping on the Lego? That hurts.
That does hurt, but I don't think anybody's going to willingly show up for that study.
I got you, right. I got you. That was given to me in a pain scale one day. From 0 to stepping on a Lego, how bad do you hurt? So, but I think we all know what we're talking about, right?
Oh,
it
yes.
hurts like
Oh, yes.
But it's a different kind of pain for sure. So.
Oh, yeah, absolutely. Okay, so yours is the second type. So what exactly is
the
that?
The second type, you have very similar attacks to type 1. You don't get as many, but you have constant 24/7 lower level pain. Which right now I'm at a 2. I'm in a very low pain period.
As we sit right now, you're pretty much at a 2 right now, or how are you right now?
Yeah. And I'll still get spikes. They can go up to an 8. I used to get spikes that went all the way up at 10, but I've had a radiation procedure that's kind of cut those out of my life.
Yes.
Well, I do want to hear more about that, but real quickly. So how did you get this? Is it genetic, or how did you end up discovering you had
For me
this?
personally, I got it through a dental procedure. I had a root canal, and the next day there it was. Most people, though, get it from a different thing. There's a blood vessel that sits on the trigeminal nerve at the root.
And where is this nerve exactly?
So your brain stem comes out of the bottom of your skull, and the trigeminal nerve comes out the side towards the front of your face.
Okay.
And then it splits into 2, one for each side of your face, and then it splits into 3.
And is that considered like one of your 12 cranial nerves,
it's
right?
the 5th cranial nerve. That's
nerve,
correct.
okay.
So but most of the time it's a blood vessel that sits on that nerve and over time erodes the outer sheath, the protective layer, the myelin sheath.
Gotcha.
So they're a little bit different in how you treat them because of the different causes.
But yours was due to an injury. Now, did they make you aware of it? I'm sure you signed the things where it's like,
it was
death is always the last thing, and you're like, okay, let's go.
It was never mentioned in any of the paperwork, but they're big blanket clauses that cover anything. The other thing is, I actually did after this go to several attorneys. Nobody would take it because it's so very skewed. Like, they basically told me they would have had to have left part of a drill bit in my head for me to be able to do anything. And I will admit, for the first 2 years of it, I was so angry about this. But, as part of this whole thing, I've gone to so many dentists around town and outer areas, and I started to stop telling them who did the procedure and asked more questions, and they all sent their patients to him too. He's apparently very good, very competent.
Wow.
I just got
those freak
unlucky,
things.
you know? Yeah. So
Wow, that's amazing. So what's the prognosis long term for it?
with trigeminal neuralgia, it can be treated. There really is no cure. There are so many ways it can be treated. The first off is going to be medication. They use tricyclics and anticonvulsant medications. The anticonvulsants block the irregular pain signals you get. It kind of puts everything in a more narrow band. While the antidepressants, they actually use for pain itself.
That's interesting.
Right.
Past that, they'll move into, well, you can move into different things like acupuncture and homeopathics, all kinds of things. But usually medically, they'll point you in the direction of something like a gamma knife, a non-invasive. Gamma knife is what I ended up having, which is where they create a lesion around the nerve itself to try to cut that pain signal. For me, it's worked
So
pretty
essentially
well.
kind of try to cauterize it from the outside in a little bit.
Yeah, almost. It doesn't
okay.
necessarily damage the nerve. There are
Okay.
procedures you can do that will actually just sever part of the nerve.
And that would involve
That
cutting the entire face open.
they actually they use a radiation. They use I believe an endoscopic technique where they go
Okay.
in and just cauterize it basically.
It's still pretty invasive though.
Yeah, and it can cause, when they do that, since it
Yeah.
is a sensory nerve for your face, the damage to mine was pretty far forward, so they could, take it here and I'd lose this much feeling. But for a lot of people, it covers this whole section of the face that would be totally numb. And in the mandibular branch, this bottom branch, it actually does have some motor control. So you'd actually lose part of your ability to
Wow.
chew. It'd become a lot more difficult if they did.
That's
do
interesting. You mentioned earlier about the medication that you was on. It's an antidepressant and it's a painkiller too. And I would think that'd be a double benefit because I can see people actually getting depressed having this condition all
I
the
could
time. I mean,
easily
your
see
whole
it.
quality of life
Absolutely.
sucks. I mean, it can anyway.
Interesting fact: one of the names as a pet name for this disease is actually the suicide disease.
Wow.
Yeah, it's been named that. I actually found that out in a really not pleasant way. One of my doctors early on slipped up and called it the vernacular name. And I'm like,
Wow.
whoa,
Right.
hold
Back
up for
up
just
now.
a second.
Yeah.
Let's talk about
Right.
this.
Right.
Oh my god.
And I can totally understand how.
Right, especially
that's
for people
the
that,
case.
that aren't treated for it, and it could really get serious, and lead to
Yeah.
that. for
Well,
sure.
that's the other problem with it is it's so very hard to diagnose because if you look at an MRI of mine, totally clean. Nothing will show up. Same with CTs, X-rays.
Because it's a nerve.
Yeah, exactly. They can't
Wow.
see
Right.
any of that, even with the normal type with the vascular issue where the blood vessels sitting on the nerve, they can't tell.
So there's no inflammation or anything like that.
There's
looks totally
no
normal.
real signs. If you do, I think it's a MRT with contrast or something, they have the best chance of seeing it. But even then, there's no guarantee.
Interesting. That's amazing.
So it's difficult to detect, and really what they have to do is go off of your description of the pain. And a lot of doctors, especially in the current environment with the opioid epidemic and everything, are very iffy about listening to, I have this pain, but it's not on any scans, and I don't have any
Right,
evidence
right.
otherwise. I lucked out and was diagnosed pretty quickly and all, but I know people who I've talked to online who, from everything they're saying, I can almost guarantee that's trigeminal neuralgia, but they've been jumping from doctor to doctor for 2 years. So,
Right.
it's
So,
it's difficult.
if you were to kind of like give people some tips out there, if somebody is having certain signs and symptoms, what should they be looking for that would kind of clue them into trigeminal
Well,
neuralgia?
the pain is usually characterized. The best I can explain it when I have an attack, it feels like somebody has run ice water through your skull and then hooked you to a car battery.
Jeez, man, I can't even imagine that, man. Golly.
Like, I'll give you just an idea. I was standing in line at a gas station and got hit by one of these heavy attacks. And, I mean, I had tunnel vision, stars dropped to the floor on my knees.
Man,
they were about to call an ambulance, like, before I could manage to talk. Like, you cannot, everything just kind of...
You're just talking about the mandibular, that's going to be affecting your talking as well.
Mine, in this case, it was just more of a pain thing. Mine is just in the maxillary, the middle branch, so it doesn't affect any of my motor. It's all sensory for that.
Still, when you're blinded by that much pain, the last thing you can do is get out. No, I'm okay.
Yeah.
Please don't call the ambulance for my copay.
Right, exactly, right. Right. So I have to ask, so, I don't really have migraines anymore. Kind of outgrew them a long time ago, and it was just part of childhood growing up, I guess. But there were certain things that triggered my migraines, and a lot of people, it's food, stress, or whatever. Mine was lack of sleep, so that triggered migraines all the time. I need to get a lot of rest, and of course, being in a dark room. But I've read from migraine headaches, what triggers a migraine, what causes it usually is dilation of the blood vessels in the brain. That's what causes migraine. So the migraine medication you'll take is usually aspirin and caffeine, stuff that kind of constrict blood vessels. So do you think that when you have an attack, do you think that blood vessel that's sitting on top of that nerve is being dilated possibly? Or?
It is possible. That's another weird thing about this. It's such a rare disease. A lot of the stuff, since there are treatments out there, there's not a lot of active research.
That's why I was going to go there, research. Yeah.
So that's
and
kind of.
And what you
an
had
issue.
The numbers? How many people in America right now?
The numbers are questionable with diagnoses and all that, but very roughly they're putting it at 108,000 in all of the United States.
Which is
I'm
so
sorry.
Small.
Yeah, no, I said it right.
Before.
Okay,
yeah,
that's right.
Yeah, that's probably a conservative number too. It's probably a lot more.
Yeah,
than
especially if it's so underdiagnosed,
Right, exactly. So a lot of people out there have it and just don't have a name on it.
So it all starts pretty much with the GP doctor. I mean, you're a general practitioner. You go to him with these signs and symptoms, and hopefully you have a doctor that's going to be open-minded and going to try to research the things that's going on. And did they need to refer you to like a neurologist? Or,
neurologist is the best next step. Or also an ENT can help, because there are certain sinus issues that can give at least in the early stages, similar symptoms. I mean, I hit the whole gambit: dentists, GPs, ENTs, neurologists, neurosurgeon, pain management, physical therapy, acupuncturists, on and on and on. So, but yeah, the best bet, see your GP as soon as you start getting pain. Usually people will think it's a toothache is where it starts. So usually you'd go to the dentist. Dentist can't find anything wrong. They'll send you to an endocrinist. And they'll look at it. If they still can't find anything, they'll refer you to a GP, talk to your GP, then go to the neurologist. Neurologist will probably start you on medications, see how that takes. You're usually at this point like 4 months in already because of how long it takes to go from specialist to specialist.
True.
That's about how long it took me. So after that, they'll mess with the medication for a while, and then send you over to a neurosurgeon to look at, what can be done. To put it this way, basically, over my time, I've seen 27 different doctors.
Jeez,
wow.
Man.
In between all that, I've been on 7 medications. I've done acupuncture, lidocaine injections, tried homeopathic stuff, turmeric, reishi mushrooms, B12, tried keto, tried CBD, kratom, capsaicin. I've tried home TENS units.
Wow, man! I tell you what, man, you're giving it a shot, man.
Yeah. But finally, the Gamma knife ended up doing it. The one concern I have about the Gamma knife is, and with most of these things, is it's not really a cure. 50% of people who undergo Gamma knife within 3 years have a recurrence of the pain. It comes back.
So you think it's worth it to try it, or
Gamma knife? Yes. The other main one you see is I always forget the name. Microvascular decompression surgery, which is actually an open brain surgery.
Wow, man.
They go in and they put a protective sheath around the nerve to prevent that blood vessel from rubbing. And under any open brain procedure, there are definite risks. It's a lot safer than it was when it was developed in the late 60s, I think.
Wow.
But I mean, you're still looking at, you know, a possibility of fatality, you know, hearing loss, stroke, heart attack, and on and on and on. But even that one, it gives you the best chance of a long-term solution. But I think after 5 years, you have slightly over a 25% chance of being back in pain.
So when we talk about the trigeminal nerve, what does the trigeminal nerve do?
It's basically any sensation in your face. That's from the trigeminal nerve. You feel this touch when you kiss somebody, when you're, you know, anything like that.
So of course, cutting that nerve would not be an option because it would really decrease your quality of life because you wouldn't be able to feel anything.
Or move your entire face, I would assume, huh? It would cover
it doesn't cover. It's mainly just feeling. The lower branch does handle some mobility, but not all.
Okay.
So overall, it is just a feeling thing.
Right. So we need all 12 of those cranial nerves because I know once for taste, you know, you got smell, taste, your ocular nerves, ears, all kind of stuff and everything. So.
Yeah, so much branched together and bunched right there that anything could go wrong. That's scary, but
so
I'm so glad it's working right now. And how long ago was the Gamma Knife procedure for you?
I believe about 1.5 years ago.
Okay, so you're kind of coming up on that halfway mark.
It took about 4 months to really start noticing a difference. It's slow because they create that lesion around the nerve, and it takes time to set in and all that.
So of all the different options you've tried, what is the thing that's worked best for you, pretty much?
The Gamma Knife has gotten rid of the level 10, oh my God, I'm a non-functional human being attacks. I still have that constant pain. For that, I take Tegretol and Percocet, actually, which if you talk to most people, they'll say, oh, opioids, Percocet, they don't work on this. That usually is the case because it's a nerve issue. But because I have atypical, it is used when other medications have failed.
Right.
So,
of course, each case is different, of course.
Yeah, exactly.
So, right. Very interesting, man. Well, so you married right now?
Nope. My girlfriend Jen's over here.
Okay. Well, hello, Jen. How you doing over there? She's kind of off camera right now. We can't really see her.
We love Jen.
The reason I was asking was because you know, somebody has to live with you with this condition. So I mean, how is that working out? You know, in the friendship environment, living environment.
So far, I think we're doing good. The majority of the time I had this, I was with somebody else. I no longer am. We were together for 10 years up to the point that failed. It's
as a result, because of the trigeminal, or just
I think it's
personal, or whatever.
It's a very large part of it. I feel because when it's bad, when it was really bad, the depression is horrible. You end up fearing the pain. You know, like if I have a day where I was at an 8, I was like, okay, that's it. I got to rest. But 7's okay. Well, after some time goes and you're living in this pain and it's wearing you down 24/7, it becomes, well, I've got a 6, I'm just going to go lie down. And it keeps getting to where if you're in almost any pain, you just don't want to go anywhere. You're afraid if I do this, if I go here and do this thing, my 10's going to come and I'm going to be stuck with this. So you withdraw a lot. And it really kills your personal relationships all around.
And being in pain all the time. I mean, you're
miserable.
Not the
Everything
makes me. I mean, you're angry. Like just sometimes I'm in pain. Like you're just not yourself. So I can't even imagine feeling that way for that long.
Yeah.
You know.
Yeah. But no, it. I think it exacerbated some issues that were already hanging out in there, and that's one thing I'm very active on. Trigeminal neuralgia forums, and that's a lot of what you see. The majority of what you see is either people asking, hey, is this trigeminal neuralgia, or it's loved ones being like, how do we handle this? Because a lot of people go through a change, you know, either immediately, some people over time, and it's horrible for your loved ones to watch.
I was going to ask you, you mentioned forums, if there were any, I'm sure there's support groups out there.
Oh, there are. Stuff like that. One of the really big ones is the Facial Pain Association. Their website is fpa-support.org. And they have all kinds of information. They have quarterly reports with some of the newest research.
Nice.
They actually have organized October 7th is Trigeminal Neuralgia's Awareness
That's
Day.
right.
Excellent.
And they organized all that.
What date is that again? I missed it.
October 7th.
October 7th. Okay.
Yeah, and they've
just passed.
they've been doing that for 5 years. I think it was officially recognized by Congress 2017, I think.
Oh, wow.
Excellent.
But the other one, there's a group on Facebook, which is part of the FPA, I think. It's the official Trigeminal Neuralgia Network.
Excellent.
And then on Reddit, there are a couple subreddits for it, just Trigeminal Neuralgia. Those are the ones I frequent. There are a couple other, fringe ones out there that I'll
Have you gotten
any
any good information out of any of these sites?
I have gotten a couple things to try, most of them more towards the homeopathic side of things. It's more a lot of support and listening to other people talk about their pain. It helped me a lot in some ways because you realize, like, even as awful as mine was, there are people with the same condition that are so much worse off.
Yeah.
I was able to hold my job down. I mean, true, I missed days and would cry in the server room sometimes,
Right.
but
Yeah, you hung in there.
there are people who just can't work. They can't function outside, with this. So it really opens your eyes in a lot of ways.
Yeah,
with that.
I kind of have to go back to like the research aspect of it. So it's like you ask yourself, is there any way to prevent this, or is it just going to happen no matter what? And then on the backside of it, okay, now that you have it, research on how to better treat it, how to cure you from it, I guess, if there's a cure or whatever. So to me, research is definitely a way to go.
And I'm kind of wondering, since it's so new, if maybe it's a lot of people who have unexplained migraines and things like that, if maybe this could be
Yes, I'm not sure.
another way to, or something else they could have. Unfortunately, there's not a way to test for it, but
Yes.
it could be another option to at least look into if they're having no answers.
And I can say, having migraine headaches when I was younger, I wouldn't wish that on my worst enemy. That's the worst pain ever. And I've had kidney stones 3 times, and I've dealt with it. I didn't even go to the doctor. I got a high tolerance for pain, but migraines is something. That's when you hurt so bad you start throwing up.
Yep.
That's one of those things. It's so much different. Like, I've broken bones, barely flinch, but when you hurt in your head, in your face, it is so much different. It just really, incapacitates.
It's literally
you.
your nerve center of your body.
Yes,
it's literally the nerve center.
Exactly.
So,
That's
it's
exactly
gonna hurt.
Right. Yes, that's exactly why. That is something. I've also been out. Speaking of pain tolerances, I've been out of work 3 months with a back injury, and that was the most excruciating pain I've ever had. Was my mid back area when I got thrown out the ambulance by a psychiatric patient, and I got injured. My back was injured, and then you don't even realize how much you need your back till it's gone. You wake up in the morning and you can't get out of bed. It's like, oh my gosh, I need my back is very important. Wow.
It's amazing how much you take for granted until after you start hurting from it. Like,
Yes.
I don't have my brace on right now, but even little things I've had to just go and said, oh, I can't get up that way. I have to use my forearm. And they're always on me. Don't, where's your brace? Do it. Don't push that. Don't move that.
Right.
I'm like, okay.
Right. Your little toe, if it's hurting, it means something to you,
Yeah,
so
absolutely.
you put everything into perspective, but there are certain areas that are worse than others. Like your head has got to be like the worst of all for sure.
Absolutely. I'm so glad we were able to shed some light on it and hopefully educate people.
I really appreciate having the chance to come on and talk about it.
Absolutely.
Yes, we want everybody that's watching right now to like and share this video, get it out there. A lot of people might be interested in seeing what we're talking about and maybe get a little bit to gain from this and maybe help them out some kind of way.
And if you just help one person, you never know who might see it and who it could help.
That's
so
exactly right.
And we appreciate you so much for coming and talking about it. I
Absolutely.
know it's a lot to get into.
Yes, right. We probably could do like a whole 1 or 2 hour show once we did the research and delved into it real deep and find out
I would absolutely love to do it.
Yeah. When we get time next year, when we get on a roll and we get our whole studio set up and everything.
Graphics set up.
Yes,
and have
right.
a whole little thing going on.
That's what I'm talking about.
Like
that's
a Dr. Oz thing.
Yeah, absolutely right. We get a video wall because we got to get like 4 TVs, make a video wall.
That's
so
right.
That's gonna be really cool. So, is there anything else that you want to kind of add, or I might go over? The floor is yours. Take your time.
Well, I
see
think
you got a lot of paperwork right there.
Lot of it.
I know.
Yeah, I went back through and did some notes. I think really a couple things. I'm just trying to think real quick.
Take your time, man. No problem. Yeah. We can edit this. No problem.
There we go. No, I think that really did cover a lot of it. Another thing that a lot of people have it complain of, and it's still one thing that I fight with a lot that we didn't get to cover, is they put you on all these medications and you end up fighting the side effects a lot of the time. Like I'm still in pain. Was on one medication, Lyrica, for a short period of time that really helped so much with the pain. I had to get off of it because I had walking blackouts, vertigo.
Goodness.
I actually had to call into work one day because I could not put my pants on.
Cool.
Like I was
Wow.
just so disoriented.
And that's because of the medication, not because of the trigeminal.
Yeah, that was because of the medication. And
It's
to
a
this
Like,
trade-off.
what's better, the treatment or the problem?
Right. Yeah. It's
Yeah.
a trade-off.
exactly, and it's finding that balance, and you see that all over trigeminal neuralgia forums too, is people just fighting the side effects, trying to get the balance of pain and side effect to where they can function.
And then they want to medicate you for another one. So, oh, well, this will counteract
Right.
that side effect, and this will counteract
Well,
this. And before you know it, you're 10 a day.
Yes.
And,
Oh yeah. Well, even worse is the fact that the medication in a lot of cases stops being effective after several years.
I build tolerance up to it.
Yeah. So there is that.
That's why I'm always kind of gearing toward the side of homeopathic treatment and stuff like
yeah.
that, and vitamins and just natural remedies. Not saying that there is anything for this or whatever, but it's worth exploring. And you have explored this kind of stuff,
Yeah,
like the
and,
CBD and that kind of stuff and everything.
Yeah, there are one big one is B12, they say. And
B12. Wow.
Actually, they suggest now there's fledgling research into the keto diet because keto's high fat. It's damage to the myelin sheath of the nerve,
right.
which is fat, basically.
Okay, so kind of help replenish those.
Yeah, that's
Okay, I
kind of
see.
the idea behind it. Keto's actually been used to treat epilepsy, which is a nerve condition since the 1920s, I think.
Wow. Yeah, it's incredible.
So, well, not keto itself, but a
But-
very similar, they
Yeah.
change names every couple of years. So,
That is super interesting. Wow. Yeah. So, do you think that TN is a part of a class of other symptoms or syndromes, or is it a category all by itself?
I think its own thing by itself. It's really at the base of it. It's nerve damage. It's kind of it's like MS but localized and very intense. So I mean there are a lot of things similar. Actually, that's interesting that MS can actually cause trigeminal neuralgia.
I was just about to wonder that if it gets in the right spot behind that
Yeah,
blood vessel.
it can actually do that.
Ooh.
The other thing that's another interesting cause for it is shingles. Gets the nerve later on in life.
Because that attacks the sheath as well.
Yeah.
Interesting.
Yeah, it
So,
is. Of course, shingles is a very painful condition too.
Oh, yes, without a doubt.
So if you had chicken pox, of course, that's supposed to protect you
that
from
terrifies
it.
me.
Right.
Yeah.
I know. Have
I've
you
had,
had
well,
chicken?
I had them real
Yeah.
bad, real bad.
Did you get them later in life or earlier?
No,
in
when
life?
I was younger. My mom, I had them underneath my fingernails, in my eyeballs, in my
Cool. You got it
nostrils,
good.
in my
Oh,
throat.
dear Lord.
In every orifice. I was 7. I couldn't eat or drink or anything.
Man,
and
yeah.
she counted 30 on one side of my nose and was just started
Oh.
crying. She was like, oh,
Well,
my
better
baby."
have it earlier than younger. I caught it when
Yeah.
I was 12 years. I caught it when I was 12 years old in a hospital while I was admitted for something else.
Oh, no.
So of
Oh,
course,
it's the
hospitals are not
worst.
clean places as people think on average.
No.
And so I remember getting chicken pox at 12 years old, and it wasn't a pleasant
I think
thing.
I was 6 or 7, so I was still little.
Right. Remember they had the chicken pox parties where you brought all your
Oh,
kids
I
over there
yeah, I
and just
heard
get it, let
about
them
it.
all catch it and just get it
Oh,
over
no.
with.
I caught it from my brother who had 1 or 2, I think that maybe 3 that popped up on his back, and then I ended up with looking like Gollum, and
Right. That
It's
is,
fine.
Oh
Just
yeah,
how it went.
it's all part of growing up.
But they say that the worse you get, then the less chance for shingles later, hopefully. So
Yeah.
maybe,
Well, it kickstarts your
a
immune
plus.
system, that's for sure.
yes,
It really
definitely
does.
had plenty with that. so.
Yes, it does. I was asking you about the class because my sister died of ALS recently. My half sister
I did
actually.
not know that. I'm
She
so
sure did. I
sorry.
never got around to telling you that. So within 4 months, she went like me and you to dead in 4 months.
Oh.
And I mean, it was rapid. It was real fast. And I mean, next thing you know, she's in a wheelchair. Then she's paralyzed. She can't talk, and then she's dead.
It's so
And
aggressive.
it's like you've got to be joking. So that, of course, is a part of a nerve like MS. They're all related. ALS, MS.
Right.
They're all kind of similar. And I've looked on YouTube and places where people have actually beat it or slowed it down or even stopped it from natural cures and stuff like eating right, changing your diet, taking the aluminum out of your teeth is another thing. A lot of people have aluminum fillings. And so they have the correlation that aluminum in your bloodstream via vaccines, via cavities or whatever fillings, that aluminum it slowly goes into your bloodstream over a period of time.
Deodorant.
And deodorant is another one. Yes, it is. That is another one. Yep. I don't. I wear deodorant, spray deodorant very occasionally, but for that very reason, yes.
I'm bad. I wear that. Yeah. I wear the bad kind.
Right. If you just take a lot of baths, you don't have to wear deodorant. But yeah, it's true though, right? So aluminum is a big thing too. Yes, and it makes you wonder.
That's
really
interesting.
Yeah, so you never had this problem when you were younger, right? I mean, this just happened.
This is from that
very sudden,
yes.
right before my 30th birthday.
It's you have to just wonder. I mean, did something cause this, or was it just like lurking silently, and then all of a sudden it just
that's
appeared?
The hard thing because you can't prove what did it. Like it's one of those things. Well, I had a root canal, and the next day it was downhill from there, kind of thing. But it's you never know. I mean, it could have been something that was lurking there, and that just set it off.
Yes, and it also makes you wonder. So trigeminal neuralgia, is that how you say it?
Yeah.
So it makes you wonder if this condition could be on another nerve besides your trigeminal nerve. Could it be like anywhere else in your body? Probably not, I guess, right?
It would be called. I mean, there are different neuralgias, all that based off of the nerve. I don't know exactly if any of them have that exact same cause, but I mean, any kind of, I think they still call just general trauma to a nerve a neuralgia. I'm not sure. I don't remember.
Right.
I kind of stick to my little narrow little.
Yeah. Right. Sure. Right. So. Oh yeah. So I know a neuroma is what I was diagnosed with a while back on my foot, and it was a real painful bump on my foot, which actually was a bundle of nerves. And so we had a pharmacist over here. He made all these little custom concoctions or whatever. So he actually made a cream, and it had some kind of painkiller stuff in the cream. So you put the cream on the foot, and I mean it was kind of like a lidocaine, xylocaine or whatever. Just kind of numbed it or whatever. Mm-hmm. But it worked really, really good. And you couldn't buy it commercially. He just made this in the back of his pharmacy.
Of course.
Isn't that cool? But of course it wouldn't work for you because that's like way deep in here. So
yeah, I tried the lidocaine, surface lidocaine, and the lidocaine injections, and
right.
I'll tell you, putting on the silly bombs for mosquitoes. It's like ha ha ha.
Yeah, right.
That's cute.
But I will tell you, like speaking of pain, one of the most excruciating pains that I've ever had was a cavity in my tooth, and you can vouch for that too. I mean, that thing hurts like heck. I mean, it is bad.
My worst was when the wisdom teeth were out. That was not pleasant.
Not pleasant.
They were coming in this way and compacted, and so they wanted
sideways?
to. Oh yeah, at one point my doctor wanted to break my jaw and do all this stuff because they thought I had too small of a jaw, and I was like, no, I'm good, But they ended up coming in. I felt them coming in, thinking this is the top. It was really the sides.
Wow.
They got a little. I mean, the surgeon said I had to really climb on that chair, and I mean yank it out. And I was like, I could have done without that visual, but okay, thanks.
Wow.
But he was like, this is why you're hurting so bad, essentially. And they actually hit a nerve. Now that I think about it, when they did that, they hit a nerve, and I was numb from here. It was like this part of my lip, my chin, my teeth, and my tongue, but I could still feel underneath my teeth and like the underneath part of my tongue and weird parts. But like
it temporarily came back later on.
6 to 9 months, I think it came back.
Months.
Yeah, and it was completely numb from here to here, and it would come back in tingles, and it would hurt so bad. That's probably the worst than anything is in the pain.
Probably damage to that
alive.
third branch right there, the lower branch.
Similar to it, yeah. So.
Yeah, I mean, if he's out here like pulling on your teeth or whatever, he's got to be damaging something.
I got very, very lucky that it was just temporary. Thank goodness.
Did he give you laughing gas or put you out totally?
Oh, I went out totally for that one. They said, "Oh, no, these are in there. Good, we got to put you out." So.
That's amazing. Wow.
Yeah, it's funny.
I'm the kind of person I want to go bring my video camera, just kind of set up, and I would like to watch that video afterwards.
Oh, my mom watched her own open heart surgery. I was like, "How did you do that?" Like I would have. Oh, no. She can do all that stuff. I cannot. I don't want to know. I don't want to know.
I've been in open heart surgery in my clinicals, and it's extremely interesting. It really is. I could not be a cardiologist. What is that, Grant? How many? All right. Yeah, so I could not be a cardiologist. To hold somebody's beating heart in my hand, no, sorry.
Well, I did have to go in for my first surgery was a hip replacement, and so I was in school for my X-ray and everything, right. And then because I was like, I'm not good with surgeries, and my tech looks at me and she's like, come on, you can do it. And, like I was just like waiting for me to come, and I'm like gearing up, and I find the smallest lead vest I could like ever find. I couldn't get it on, so the people are like laughing at her because like, oh, she doesn't want to come in. I'm like, I can't. I meant to. I tried.
Got a good excuse.
But she was really proud of me, and I saw it was very interesting. They have a whole sheet with a little V pocket to collect all the blood. And they were like, oh, no, that's going to be for the blood. I was like, okay.
So what do they do with the blood? They put it back in? They collect it and put it back in? Or they just give blood transfusion?
Yeah, this is just like for what, because it's not supposed to be a lot, so this is to kind of keep it off the floor, essentially.
Right.
So they've got like a curtain hung up with a V pocket, so anything goes in there will just kind of naturally
splatters on
go
there.
down.
Wow.
And I was like, oh, and thank goodness I wasn't on the side where you had to see anything because I might have died. But I get to be on the other side that was.
That is super interesting, though. It is amazing.
But, yeah, it was
I'll tell you one
strange.
thing that I have a fascination for is like on Instagram. I got a couple of pages I subscribe to. Is the plastic surgery pages, like especially the ones in California. The breast augmentation is one of them. But the other thing is like the liposuction, where they'll take a lady's stomach and just like fold it completely like this, and you see everything.
No,
and they're cauterizing fat, pulling fat out, and it's amazing. It's like a slaughterhouse when they're doing it, but when they put it back together, it's just amazing, It
looks great.
And one thing is we give these surgeons all the credit, these plastic surgeons, but it's the human body which is really, really amazing.
That is very true.
Even when you see like ghastly, horrible injuries, like spikes through people's heads like this, when you look at the 6 months later after they healed up, the body heals itself amazingly. Really, it's incredible.
Mm-hmm. It really is. If only did it from the inside out.
Right. I know, really, exactly. So yeah, that's always kind of fascinating. I got my start actually being a paramedic, going to my uncle's slaughterhouse. So they would shoot the pigs and cows, and so of course they would take the hearts and all the organs. What I would always take the heart and I would stick one of the aorta in like a faucet in the sink and run the water.
To see how it works.
Right, just watch it all come out.
So cool.
Then we dig the bullets out of the pig's brains and everything. I mean, just like. It's anatomy is what anatomy class is what it was. And it's like very interesting. And of course, they don't waste anything. They eat the liver, they eat the stomach, they eat everything. Especially with the pigs and everything. So I found that to be pretty interesting.
It's an interesting way to get into paramedic.
I know. Even as a paramedic student, they go like, so we have to intubate people and everything. So let's go get the cow lungs, the real cow lungs in here. Plop them on the table, find the trachea, and intube it and squeeze the bag.
You're getting in right.
Yes, and watch those lungs fill up with air. It's like. It's amazing.
That's cool.
It really, really is. So yes, that's pretty much my interest in that kind of stuff. But
it's very, very interesting.
Yeah, it really is cool. But we like to stay alive. We don't like to be dead. We like to stay alive.
No. Yes, please. That'd be great for a little while.
Yes, right. Well. So I guess we could probably say that you're living with it. You're tolerating it. You're getting by pretty good right now.
Yeah, I'm at a good place at the moment.
Great, because you look pretty good. You don't look like you're under stress or anything. You look pretty good.
Yeah. No. Overall, it's very manageable. I'll still, and actually kind of interested like. You get sudden spikes in pain, so if I'm in pain, I'll start ticking, and it's actually over time kind of interesting. If you look very closely, my face has developed slightly of a kind of a droop because of that tick.
Oh yeah, right.
And that's actually how they kind of named it back when they first kind of sort of discovered it. They had no idea what was causing it or anything back in the 1700s. It was called, I think it's a tic douloureux. And that's what it was from. But I still get that tick. I still get sharp pains.
Is it the same that can cause Bell palsy, too, to make the face kind of droop and go numb?
I'm not sure, honestly, actually. That is an interesting question. Yeah.
So back into the 1700s, I mean, we're talking about 200 years ago.
Yeah.
200 years ago. That's amazing. Yeah. That is amazing. And I'm probably sure that it was way back before the 1700s. They just they couldn't categorize or to pin it down what it was.
Right. Yeah,
but
exactly.
it was probably still out there. So, I feel sorry for those poor guys because they had no treatment for this stuff.
Nothing. No medication.
Right.
No,
right. And they probably did throw themselves in front of a train just to get rid of it. It's amazing.
I can understand why.
I don't want to get too graphic or whatever, but I have to throw this out there because it was in the mainstream news. Did y'all see this? This lady, she actually committed suicide. She had a problem with orgasms where she had continuous orgasms over and over and over again. Not being silly or funny, but it's serious.
No,
it's serious, and it drove her crazy. She was in a constant state of orgasm. Look it up in the news. It's in the news. And she went to her doctor. They couldn't do anything about it, and she killed herself. It's like, wow.
I know that was a Grey's Anatomy episode, and I know they had to do something to fix a nerve. That's all I remember.
Really?
But, oh my God, that was.
So I feel sorry. And you can actually go to YouTube because I looked it up. And they interview the poor lady, and so I mean, it's pleasurable for like 20 seconds, but not for a lifetime.
Yeah, that's.
So
I mean,
it's like,
that's crazy. The human
too much of anything is not good.
Right. No. Right. That's right.
No matter how good it is.
Exactly right. Too much candy. Right. That's right. So that's pretty interesting. So it's like you said, the body has all these weird things that can go wrong with it, and it's it is amazing. You know?
We are really fragile creatures in the end.
Yes,
You know?
yes, we are. I was looking, thinking about the human body the other day, about how tough the human body is and how tightly knit it is. Because it's hard to, you just got to think, the tendons and the skin and all the structures of your body is like extremely strong and tensile and very, very tough and everything. Except whenever you get like a sharp knife or something that sticks your skin or something. But other than that, your skin is very, very tough. Your bones are very tough.
Oh, yeah, absolutely.
And the body's a very, very tough organism.
Yeah, and unfortunately, pain's just a way to tell us something's wrong.
Yes, exactly right. Now, pain is a good thing.
Whether or not we can do anything about it.
That's the good thing about pain. Your body goes like, oh, emergency, something's going on. What's going on,
Yep.
So, yeah, absolutely. All right, well, very, very interesting discussion for sure. So we're going to definitely have you back for like maybe an extended thing. So maybe
that'd be great.
We get our phone calls set up like we want to do. We can have some phone calls and get some conversation going.
Absolutely.
That'd be very, very good here. All right. Well, so that's going to wrap it up for that. We want to talk about a big party coming up, and you're a guest on the show, so you're officially invited, free of charge, to our party coming up in January. So
down with that. Okay.
And make sure. What's your girlfriend's name?
Jen. She's coming too.
Make sure you bring Jen. Right. And so that is going to be January the 11th, tentatively at the City Club.
Yes.
And so what it is we want to invite all of our past guests to a big party for our 75th show. And we're going to have all our past musical guests. Well, Casey's going to sing because she's got some songs. And all our other musical guests. Bud Torres said he's going to be there, our sheriff now who sings. And Claire Keller, who's on the show. And Vaughn Goodo is going to sing.
Hopefully Amanda G will come back and do a comedy set. I'm going to try to get my other friend Katie East on here soon. So we'll have some good entertainment for them.
You have got us some really good guests for the show. You really have. Keep that.
It's funny because they're mostly my friends. And people are like, you have the weirdest, neatest friends. And I'm like, thanks.
You have a good circle of friends for sure. I bet you stay entertained.
Blessed.
That's great. So we're going to have that coming up January the 11th. It's going to be a City Club, limousines, red carpet, step and repeat, dress up nice. It's semi-formal to formal. It's going to be really, really cool.
It's
I'm breaking out the tails.
Yes,
yeah.
That's right. I like you said that last show. Right.
It's a prom.
Right. So we're going to have a good time with that. So and the reason we do that is we want to show our guests how much we appreciate them, because this show is all about homegrown Louisiana talent, or not, I say talent. I mean talent. It could be people that are from Louisiana that have interesting stories to tell.
Absolutely. Anybody with anybody who knows anybody more than we do about anything, we want to know more.
Yes. Yeah. Human interest stories, like your story right here, is a very interesting story, and it's very rare. To have you right here out of Baton Rouge having something like this is something, because the good part about it is you being on our show, you bring light to this thing. So people are watching it go like, I'm not alone. I got somebody else that's doing this besides me, and maybe I can contact him.
Absolutely. And it was, I think the other number I saw was 4.3 people out of every 100,000, which we figure they get.
Yeah, that's the new cases per
year. The new
year.
cases per year. Yeah. So what we figured that's like 0.5% or something like that. Right. Very, very small.
Yeah, 0.43%, right.
Yeah, so I mean you're maybe a very small audience, but a very important audience if they have nobody else that listens.
Well, hey, look, if you're part of that 4.3% and you're hurting excruciating pain, well, then you count too. I'll tell you that.
Absolutely.
So that sounds true. So that's what we want to do. We want to have human interest stories, things that come out of Louisiana, because we're all Louisiana based. We love our state of Louisiana, and any way that we can help people out by having people like you on the show, we're all about that kind of stuff and everything. So this party is to say, let's network with all of our guests, because we all come from different backgrounds. We have some politicians, musicians, filmmakers, songwriters, all kind of people, authors. Chuck Bush he's an author. He was on the show recently, and kind of puts us together, because you might meet some people that night that maybe have some stories to tell you. It's pretty cool. So great. And we have another big show coming up, another big party coming up. Our 100th podcast is going to be coming up. They're going to have we're going to have a big one on that one too. So. All righty, well, that is going to do it. We're going to shut this thing down right here. We don't want to go too far over. Thanks, everybody, for joining us tonight, being with us. We want to encourage you to go to our YouTube channel, like and subscribe, please. Right?
Like and subscribe, absolutely.
Yes. And how many platforms are we on? What are we on right now?
We're on Facebook, YouTube, Instagram.
Those are the three main ones right there.
Three main ones, yeah. And the easiest way I found is to go to YouTube to find the direct videos. You can look up Dave K Show. That's typically the easiest way. And I do want to say congratulations again to Renee Thibodeau, the new sheriff of Point Capee.
That's it.
Best of luck. And
he will be on the show.
One more shout out to the PointCapeeReporter.com and the Point Capee banner. They've been so wonderful to support us throughout this process. So we really appreciate their support as well.
Absolutely, yes, indeed. All right. With that being said, for Timmy Gyro in the back, who's producing, Grant Gyro, and Michael McMorris, and Miss Casey Fry, and Miss Datha Bure, I am David K. Gyro, and we will see you next time on the Dave K. Show. Everybody have a great and safe night.
Thanks so much.